Republican Congressman Glenn Grothman has a very simple solution for those who are worried about the potential consequences that would come from defunding Planned Parenthood. Yes, we would shut down all these clinics, but you could just go somewhere else, man. Here's him telling it in this video.
As a guy, I could go to many clinics locally that have all the machines that one would need. All of these clinics, as far as I know, take Medicaid dollars. So they, you could go to any of those clinics to get any medical service, you could. I guess what I'm getting at is, in my opinion, if Planned Parenthood disappeared tomorrow in those towns, there would still be 3 or 4 or 5 clinics or hospitals providing all the Medicare, all the medical care you would want, and quite frankly, providing superior care to people who are on Medicaid. I guess what I'm saying is, it would seem to me if Planned Parenthood clinics were not around in those cities, with the exception of a couple of abortion clinics, there would be 3 or 4 other clinics available to do any women's health or men's health or health of any nature whatsoever.
You know, I fucked up in grad school when I would do all that shit about my sources and the research I'd done. I should have just put first page. It seems to me that.
I guess, and then, look, I'm sure I do this all the time, and I'm sure that if I read the comments, people would be saying that I do this all the time. But don't just say one thing and then reset and go, I guess what I'm saying is, and then just say it again. Like we heard you. You just you guess that there'd be 3 or 4 other clinics that would probably provide the services with the machines that you need.
The machines, I love it. Yeah.
Whatever
Snowblowers.
those may be.
Yeah.
Right.
He doesn't know.
Yeah.
Women's problems.
Yeah.
Yeah, exactly. Who knows what you need to do, what sort of saw you need to fix that sort of stuff. He said that I assume takes Medicaid. I
assume it does.
Yeah. I would just assume. I think you should defund it, and then maybe years from now do some research just in case. Don't actually look into it before you defund this organization.
If only Glenn Grothman had a staff, both in his home district and in Washington, that could make a couple of calls to those clinics and find out in, I don't know, 18 minutes whether all of them took Medicaid or not.
Yeah, like when back when this the Planned Parenthood scandal first started this time around, Bobby Jindal defunded Planned Parenthood in Louisiana. And I read a number of articles about the defunding of it, and there was some very, I think, obvious information that was missing from it. And so I called the leader of the Gulf Coast Planned Parenthood, and they made clear that there's only 2 Planned Parenthoods clinics that were in Louisiana. Neither of them performed abortions, and neither of them were involved in fetal organ research. But he said it was to get rid of fetal organ research in Louisiana. It doesn't seem to matter that they didn't actually partake in it. Nobody brought that up, and now Planned Parenthood is defunded in Louisiana. So it's interesting how that works out. Now, I, like Glenn Grothman, just assumed that it wouldn't actually hurt any of these women, but then I fucked up and I accidentally Googled it, and I found out that the CBO looked into it. And the CBO's bottom line is that as many as 650,000 women, chiefly in low-income neighborhoods or communities without access to other healthcare clinics, would lose at least some access to care. The measure would hamper Planned Parenthood's ability to provide low-income women with contraceptive education and counseling, pregnancy diagnosis and counseling, cervical and breast cancer screening, and education, testing, and referral services associated with sexually transmitted diseases. Additionally, and importantly, several thousand unwanted pregnancies and births would occur. And almost certainly, because despite what they believe, getting rid of Planned Parenthood will not get rid of abortion across America. Getting rid of the approximately 3.5 million contraceptive passing out procedures that Planned Parenthood does each year is going to result in a lot of people getting pregnant and having abortions that they would not have had if they had access to the Planned Parenthood contraception.
And it's always important to bear in mind, and I'm sure this has been repeated ad nauseum on this show, and as on others, it's only 3% of all that Planned Parenthood does is actually abortions.
Yeah.
The rest of it is anything but. As you said, it's about cancer screenings, it's about STDs, it's about all other associated things. But it's obviously that is the main focus.
Yeah.
But it represents such a tiny amount of what they do.
But but largest provider in the United States of America of reproductive health care services. Yeah. Largest provider.
Which probably actually won't surprise anyone because so many people do rely on and go to Planned Parenthood.
So, since we know that's true, who in their right mind thinks if we eliminated them? By the way, they're not going to go away. You just take away federal funding. You don't have a right to shutter them.
Yeah, you can't get rid of them necessarily.
Right, but they are the largest provider of reproductive health services in the United States of America. It would make a difference.
It would definitely make a difference. Perhaps not to Glenn Grothman. It would also, by the way, really
I
fast.
don't know. I just go to, like, when my doctor, he done retired. Glenn Grothman now, by the way, from Kentucky. My doctor done retired. I just phoned up another doctor.
Yeah, there's 10 across the street.
There's like 10, all of them at that machine where they're like, hold still, chung, and it takes a picture of your insides. I all got them.
That's a great machine. So another place that this would make a difference to funding Planned Parenthood is that despite the fact that they say that they want to get rid of the funding to save money, the CBO says that permanent defunding would increase federal spending by $130 million over 10 years. Most of the increase would be the result of thousands of unwanted births needing to be covered by Medicaid, as well as coverage of the children's health care.
They prevent pregnancies. You'll have more abortions. It's so obvious. Yeah. It's obvious. They prevent pregnancies.
It should be obvious.
Not really.